I'm really excited about all the different possibilities that you can do as a pharmacist. You know, you can go into so many different fields of pharmacy, and you can really kind of spread your impact that way. A lot of my family is from the Blackfeet Reservation. I graduated from high school there. I think it would be pretty awesome if I got to go back. You know, that's kind of my dream, is to go back and kind of give back to the community that invested in you.
I know when most people think of pharmacy, you think of the pharmacist behind like a counter, counting pills and just handing it out. But just within the last semester of me being here, I've been shown all the opportunities of clinical, hospital, working for the government or public health sectors.
I'd say I'm most excited about really like the interaction with patients and seeing like the impact that I have on their lives, and like over time then you can become closer with them, and really like community awareness and overall knowledge of health and medicine is also another reason why I wanted to go into pharmacy.
My grandma has, I think, been battling with some sort of prescription drug addiction in Myanmar. And when we went and visited her, they asked a lot of questions of like, what's this drug do? What does that do? And me living in the United States with my family, I felt a little incompetent in trying to help her, and seeing how much of value I could have been to my grandmother really made me passionate of learning about pharmacy, which is the study of drugs, and learning the effects of that.
Both of my parents work in healthcare, and you know, I've gotten to see, like, I guess I kind of grew up around it. I guess from a young age you get to kind of see the impact that it has on the community, and you know, living in a underserved community too, when you get older you kind of see how you can impact a lot of people.
During our orientation we had our ceremony, our white coat ceremony, and I realized that this is a professional program. It's different than when you go to a class during your pre-pharmacy. I really felt at home, like I was noticed in here, like my professors knew me, my classmates knew me. I had those student groups that I can be a part of. I really felt like I could connect with more people. The curriculum was very set forward to someone who likes science and math. But it wasn't just strictly you need to learn about drugs or pharmacy. There was a lot of like biology or psychology that I got to learn. So I kind of got to dabble in everything. And going through high school for 4 years and knowing that I wanted to do something in science and medical, I was a little bit drained going into my first year of college. I didn't really want to start taking literature or history, so having a set course already made for me of what I should take in a field I really enjoy was super helpful.
The chemistry program is really good here. It definitely prepares you a lot for the challenges that you're going to see in pharmacy, and you kind of get to put your foot in the door too when you do your pre-pharmacy here.
The University of Montana offered really great scholarship and financial aid, and being from Missoula helped a lot. It's just in my hometown. It was like a perfect match for me.
I just really liked the school. I felt it was kind of a cool, like, family atmosphere almost. I got that feeling more than a lot of the other schools.
The people of Montana is just a very welcoming community. Here in Missoula, I think it's the perfect fit where even people from big cities, they can still feel comfortable here, and people from small Montana towns, they can learn to love Missoula.
My name is Susu'u.
I'm Jason Shustari.
My name's Nano Steffarm, and I'm a future UM pharmacist.
And I'm a future UM pharmacist.
And I'm a future UM pharmacist.